Um, so today we're going to talk about a few protease inhibitors. As we know that protease inhibitors are mainly used to treat viral infections. So let's go to the start with a bit of a different approach by going straight away to the contraindications. So the contraindications for giving protease inhibitors is patients having acute porphyrias, okay, acute porphyrias. So porphyrias or porphyrias, okay, porphyrias refer to a group of disorders that come about from a buildup of um, chemicals that produce porphyrin in our body. Okay, so porphyrins are essential for the function of hemoglobin. Okay, so which is, I think everyone knows what's hemoglobin. It's a protein that is found in our red blood cells. Okay, that links to porphyrin. It binds iron and also carries oxygen to our organs and tissues, okay, in the body. So porphyrins are mainly they are they're very important for the functioning of hemoglobin. Okay, so when we have a buildup, okay, of chemicals that produce porphyrin, so we are going to have porphyria. Okay, so precautions. So be careful when giving these drugs to patients with diabetes and hemophilia, okay, because it might increase the risk of bleeding. So let's talk about the adverse effects of protease inhibitors in general. Okay, so we have mainly we have abdominal pain, anemia, okay, anaphylaxis reactions, anorexia, okay, blood disorders, diarrhea, dizziness, fatigue, okay, flatulence, gastrointestinal disturbances, headache, hepatic dysfunction, okay, other hypersensitivity reactions. We have lipodystrophy. It's a condition that you see for frequently. What we see when we see this in when we give subcutaneous insulin injections repeatedly to an area in the body, then we get lipodystrophy, and then metabolic effects, other metabolic effects, and then we can get muscle pain, myalgia, okay, myositis, nausea, okay, other blood effects like neutropenia, okay, and then pancreatitis, okay, inflammation of your pancreas, paresthesia, okay, itchiness, pruritus, rash, rhabdomyolysis, sleep disturbances, and this Steven Johnson syndrome, okay, and other taste disturbances, and also thrombocytopenia, okay, which is low platelet count, and then vomiting. And we have to use this drug with caution, this group of drugs with caution in patients with chronic hepatitis B or chronic hepatitis C, because of the increased risk of hepatic side effects. So main indication usually is it is given mainly to treat HIV infection. Okay. So let's focus now. We're actually focusing now on lopinavir and ritonavir. Okay, lopinavir with ritonavir. Okay, so it's given for HIV infection. Okay, the dose initially is um, by tablets, by mouth. So it's given by mouth using tablets. Adult doses is usually 400 or 100 milligrams twice daily, or you can give 800 milligrams or 200 milligrams once daily. Okay. For oral solution, for adults, it's 5 milliliters twice daily to be taken with food. Um, okay, to be taken with food. The oral solution contains 400 milligrams lopinavir. Okay, and it's 100 milligrams per 5 milliliters of the drug. Particular precautions for this drug. Okay, as mentioned previously, it's pancreatitis. Okay, and then cardiac conduction disorders. Okay, cardiac conduction disorders. So if you have a conduction disorders, if someone has got cardiac conduction disorders, so we need to be cautious before starting them on these two combination of drugs. Okay, which is lopinavir and ritonavir. And also be cautious in patients with a high risk of cardiovascular disease. Okay, especially if the 10-year cardiovascular risk is greater than 20%. And also be cautious in patients with a structural heart disease. For interactions, we have to be cautious if we are giving this drug concomitantly or together with drugs that prolong QT or PR interval. So for pregnancy, we have to avoid oral solution because it has a high propylene glycol content. Okay, and tablets, we use it only if the potential benefit outweighs the risk. Okay, because we have only have data for toxicity in animal studies previously. I'm not sure whether we have um, human studies data of toxicity nowadays. Let's go back to the adverse effects or unwanted effects of the drug. So we basically can divide it into two, the common or very common ones. These include amenorrhea. Okay, so their menses will be stopped. Okay, having anxiety, having joint pains, which is arthralgia. Okay, colitis, which is inflammation in the colon, hypertension, menorrhagia. Okay, menorrhagia, excessive menses, neuropathy. Okay, they might have pain here and there. Night sweats. Okay, sexual dysfunction, and also weight changes. So those are the more common more common ones. The uncommon ones include having alopecia, atrioventricular block, cerebrovascular accident, okay, convulsions, deep vein thrombosis, having dry mouth, having gastrointestinal ulcer, hematuria, myocardial infarction, nephritis, okay, rectal bleeding, stomatitis, tinnitus, okay, having tremors, and also visual disturbances. So these are all uncommon adverse effects of taking the combination of drugs. So the question might arise as to why we combine lopinavir with ritonavir. Okay, so ritonavir So ritonavir is present, it's available there. Okay, why do we have ritonavir there? Ritonavir is there to stop the metabolism of lopinavir. Okay, it's used to stop the metabolism of lopinavir. Okay, and therefore increase the plasma lopinavir concentration. Okay, so that's why the formulation that we use is lopinavir in combination with ritonavir, and that's the drug that's a combination that we're currently using, or I would say experimenting to treat COVID-19 infections. Okay, that's all. Maybe next time we'll discuss about the more on the drug interactions between lopinavir, ritonavir, and other drugs. Okay, that's all. Bye.